Good morning. Thank you for joining us for our virtual event this morning. We waited a few minutes so that we can allow those that wanted to attend to join us. My name is Ruth Hoffman, and I am the Medicare benefits specialist here at Storen Financial. And as you see here, our goal is to help individuals coming onto Medicare understand what options they have. And even if you're already on Medicare, sometimes it would benefit you to sit with someone like myself to have a better understanding of your benefits, because there can be some confusion. So let me tell you a little bit about myself. I have been in the Medicare benefits arena for over 20 years. Have been working in healthcare since 2006. And I'm certified to market the Part D, the Medicare supplement plans, Advantage plans, and I am certified on an annual basis because things do change and we want to stay current in our area of specialization. So scheduling an appointment to meet with me comes to you at no cost. Basically, the reason why we are scheduling the appointment is because we want to evaluate what medications you're taking, because that's a component of the overall consultation. I want to explain what options you have when you come on to Medicare, and explain what financial responsibilities may be based on your final healthcare selection. Okay, so we're going to get started. It's called Get to Know Medicare. And some of the topics that we're going to cover are, what is Medicare? Who can get Medicare? Do I need Medicare if I plan to work past 65? What does Medicare cover? What can I get or where can I get more coverage? What does it cost? How do I choose Medicare coverage? When can I enroll? When can I change my coverage? And how can I save money? Okay, so what is Medicare? So Medicare is a federal health insurance program for eligible U.S. citizens and legal residents. It's funded in part by the taxes you pay while working, and it's individual health insurance. What it is not is free. It will no longer be a family health plan like you may have when you were employed. It is not Social Security, and it is not Medicaid. Those are different things. So let's talk about Medicare. So again, it's for those individuals that are U.S. citizens and legal residents here in the United States. In regards to the legal residence criteria, you must be in the U.S. at least for 5 years in a row, and including 5 years just before applying for Medicare. Those that are eligible for Medicare typically are 65 years of age and older. Some are younger with a qualifying disability, and any age with the diagnosis of end-stage renal disease, or ALS, which is Lou Gehrig's disease. When do I need Medicare if I plan to work past 65? Do I need Medicare? So let's talk about that. Medicare enrollment options working past 65 may differ. You may be able to delay, or you may have to enroll at age 65. If your employer has more than 20 employees, then you can delay putting Medicare in place, because your employer's health coverage is considered credible. So you will not have a penalty if you put Medicare sometime down the road when you retire. If you are age 65 and your employer has less than 20 employees, and your coverage is not considered credible, then you will have to come on to Medicare. And then it says, what if I'm covered under my spouse's employer plan? You may be able to delay coming onto Medicare, again, if the employer has more than 20 employees. And again, it depends on your spouse's employer and any rules the employer may have in regards to covering dependents. Getting Medicare while working. Medicare and your employer insurance plan can work together. You can take any part of Medicare, or if you take any part of Medicare, you will no longer be able to contribute to an HSA or a health savings account. That will have to stop. Medicare will not cover anyone but you, so consider how any dependents will be covered. So how does Medicare work? Can we move that box? So original Medicare is Part A and Part B. So let me tell you what Part A is. Part A covers hospitalization, sort of, for example, inpatient care, or if you have to go to a long-term care facility for rehabilitation. Part B covers doctor visit, outpatient services, any medical situation where you're walking in and walking out for treatment. That falls under category B. It's not letting me leave the slides. Okay, I'm sorry. So let's talk about the Part A. So the Part A, like I mentioned, is for hospital stay, inpatient care. And these are some of the things that fall under the Part A category. Your hospital room and meals, intensive care, the prescriptions that are administered to you while you're in the hospital, as well as labs and x-rays. If you have a visit to the operating room, skilled nursing services for rehabilitation, hospice, part-time skilled care for the homebound after a qualified inpatient stay, and rehabilitation services after a qualified inpatient stay. Let's talk about what Part B covers. Part B covers doctor visit and outpatient care. Here are some examples. For example, doctor visits, wellness visits, vaccinations, labs, x-rays, physical therapy, diabetic screening, mental health, durable medical equipment like oxygen wheelchairs, and ambulatory surgical services. For example, if you go for an outpatient surgery, that falls under Part B. Some fast facts. When it comes to Part B, there is a monthly premium, and that is adjusted for income. I want to share with you a term called IRMMA. It's called Income Related Monthly Adjusted Amount. And you may want to go to Medicare.gov and learn more about IRMMA, because depending on what your income, your adjusted gross income was 24 months prior to coming onto Medicare, is going to determine your Part B premium. Just to give you an example, if a person individually earns less than $97,000 and they're applying for Medicare in 2003, they're going to look at your 2001 adjusted income, and then your premium would be $164.90 if, as a single individual, you earn less than $97,000 in 2021. If you are a married couple and you earn less than $194,000 in 2021, then your premium for Part B would be $164.90. If you're above those numbers that I mentioned for single or married couples, then your Part B premium is going to be adjusted for that higher income. You can't be denied coverage under Part B. The coverage is a nationwide benefit that you get through Medicare across all 50 states. And premium penalties for late enrollment are applied unless you have a special election period. So enrolling in Medicare needs to be on a timely basis so that you do not incur penalties. Medicare does not cover everything. So let me explain what Medicare Part A and Part B does not cover. It doesn't cover all the costs for your care. You're going to have out-of-pocket costs with no limits. Doesn't cover prescription at the retail level. Routine eye, vision, and hearing is not part of Medicare. Eyewear is not either. Long-term care or custodial care is not covered. Excess charges for services by doctors who don't accept Medicare assignment is not covered. And care outside of the United States except in certain circumstances. Where can I get more coverage? So once your Medicare Part A and Part B is in place, there are really two options. It's either option 1, which is on the left side, or option 2. Let's talk about option 1. Option 1 would coordinate with original Medicare. So when you go to the hospital or the doctor, you're going to show your red, white, and blue card. Medicare is going to pay first. And then towards the bottom of the slide on the left-hand side, I would highly recommend you put a Medicare supplement insurance plan in place. The reason being that if you're just on Medicare A and B only, there is no limit to your financial exposure when it comes to deductibles and co-insurances that you'll have to pay when utilizing Medicare services. You would like to put a Medicare Part D in place that's offered by private insurance companies so that you can have assistance in paying your out-of-pocket costs when it comes to prescriptions. The other option you have is to look at option number 2. You still have to be enrolled in Medicare Part A and Part B. You still pay your Part B premium, and typically that comes out of your Social Security check, or you make direct payments to Medicare. When you select option number 2, you're letting Medicare know that you are going to affiliate yourself with a Medicare Advantage plan that is offered by a private insurance company. And that private insurance company is going to be responsible for covering your benefits under A, which is hospitalization, B, which is doctor visit outpatient services. Many of the Advantage plan also include prescription benefits, and they offer additional benefits like vision, dental, and hearing. So when you're on the Medicare Advantage plan, you put away your red, white, and blue card because you are enrolled in a Medicare Advantage plan, and they are responsible for delivering the benefits for A, B, and D. So a Medicare Advantage plan is another way to get your Medicare benefits. It's an alternative to original Medicare. They have to deliver the same benefits as original Medicare in regards to A and B services. Plan members are still in the Medicare program. It's just that Medicare subsidizes your enrollment in the Medicare Advantage plan, and those benefits now are going to be administered by the plan, the Medicare Advantage plan. And those plans, again, are offered by private insurance companies. Many of them include drug benefits that are embedded in the plan. And unlike original Medicare, they bring additional benefits like dental, vision, and fitness. Okay, so let's talk about the Medicare Advantage plan. So the Medicare Advantage plan, like I mentioned earlier, covers benefits under A and B, just like original Medicare. Most Advantage plans include prescription drug benefit. And like I've already mentioned, there are some additional benefits and features that the Advantage plan brings that might be of interest to you. For example, there are dental benefits, vision, hearing, and there's a wellness program that allows you to use fitness facilities in your community. So a Medicare Advantage plan can fall into any of these categories here, both on the left and right. There are Advantage plans that are what are called Health Maintenance Organization plans. They're an HMO. And with an HMO, all services have to be received from providers that are networked with that particular plan. The challenge with the HMO is that if you go to a provider that is not networked with the HMO plan will not pay, and neither will Medicare. You'll have the entire bill. The PPO, it's called a preferred provider plan, gives you greater flexibility than the HMO. With a PPO or preferred provider plan, you can utilize services in and out of network. If you utilize benefits within the network, your out-of-pocket cost is lower. If you go out of network, then you'll have higher out-of-pocket costs, but it will be covered by the plan. There's also what's called a private fee-for-service plan on the right-hand side. Allows you to see any provider that's willing to file with the plan. It gives you the greatest flexibility. And then there's what's called a medical savings account, or an MSA. And those are plans that deliver benefits under A and B only. They do not deliver prescription benefits. You have to add that to get the prescription benefit. But many of them will contribute to a savings amount on a yearly basis to help you offset your out-of-pocket costs for services under A and B. So some fast facts. Again, you must be enrolled in both Medicare Part A and Part B and live in the service area. You can't be denied coverage based on current financial or health status or a pre-existing condition. You may be required to use providers and pharmacies network with the plan. Coverage and costs vary by plan and may change each year. There's what's called an annual limit on out-of-pocket costs for covered services. And this is specific to Part A and B services only. Does not include the cost you pay out of pocket for prescription, dental, or vision. There may be plans that charge a monthly premium, and you must continue to pay your Part B premium to Medicare. So coming onto an Advantage plan does not exempt you from paying your Part B premium. That is your obligation. Let's talk about prescription coverage. There's two ways in which you can tap into a prescription drug benefit. One is by enrolling in a standalone drug plan. You have decided to stay on original Medicare and put a Medicare supplement plan in place, and then you add the Part D, like we mentioned, under option number 1. Or you may be under option number 2 and enrolled in a Medicare Advantage plan, and many of them include prescription drug benefit. So whether you have a standalone drug plan or it's embedded in your Advantage plan, the drug benefit is set by Medicare. Part D plans cover types of drugs most commonly prescribed for Medicare beneficiaries as determined by federal standards. Specific brand name drugs and generics are included in a drug list, which is called a formulary. That's why whenever I sit with someone that is coming onto Medicare, I like to ask, what medications are you on? Because we want to make sure that I explain to you how your drugs are going to be covered under this new environment. Commercially available vaccines not covered by Part B fall under the Part D category. Okay, so when it comes to prescriptions, as you see on the right-hand side, there's what's called a formulary tier. And as you move from tier 1 to tier 5, medications become more expensive. And why that matters is because the total cost of the medications that you get filled on a monthly basis are going to be deducted from the annual amount that Medicare says the drug plan needs to deliver. And more importantly, when you look at medications that are like on tier 3, 4, or 5, there may be a deductible that you have to pay first before the plan delivers any benefit. So let's talk about this current year. What happens as you're moving through the various stages when you're on a prescription drug plan. There may be a deductible of as much as $505, and typically those are for the tier 3 to tier 5 drugs. Once that deductible is met, then you start with your initial benefit of $4,660 worth of total drug benefit. So whether you start January 1st or May 1st, this calendar year, the drug benefit is $4,660. And as you are filling your prescriptions, you are depleting that $4,660 by the total cost of the drug. So for many folks, this initial benefit is ample, but for others, for example, if you're on like inhalers or expensive injectables, that benefit is going to be depleted and you're still going to have days left in the calendar year. Then you move into what's called the coverage gap or the donut hole. And so when you move into the coverage gap or the donut hole, now when you go fill your prescriptions, you are paying 25% of the costs. The drug plan is paying the other 75%. And we do not exit the gap or the donut hole until together we satisfy $7,400. If that were to happen, then you move into catastrophic coverage until the end of the year. And then your cost is only 5% of your medications until January 1st comes and we start again moving from left to right with your benefit. So there are dollar limits that can change each year. Not all plans have a deductible. And like I mentioned, many individuals will never reach the gap or the donut hole. So some fast facts. In order to enroll in a prescription drug plan, you have to be enrolled in Medicare Part A, Part B, or both. You may be required to use pharmacy that are networked with the prescription drug plan. There are many drug plans out there that offer different coverages and costs, and they change on an annual basis. And if you do not enroll in a Part D or prescription drug program when you're supposed to, unless you have what's called a special election period, Medicare will assess you what's called a late enrollment penalty. Okay, so let's talk about the Medicare supplement insurance or a Medigap. That is what's going to coordinate with original Medicare under option number 1, many slides in the past that we talked about. So that's when you're wanting to be able to utilize Medicare. And really what happens when you're on Medicare Part A and Part B, you can go to any doctor, any provider that is willing to file with Medicare across all 50 states. It can't be used in conjunction with a Medicare Advantage plan because it's either you're under option 1, which is original Medicare, or your option 2, which is the Medicare Advantage plan. The Advantage plans, the Medicare supplement plans, there's 10 standard plans that are federally and statewide standardized for the consumer. So a Plan G with United Healthcare is a Plan G with Mutual of Omaha or Physicians Mutual. The only difference is perhaps the premium that you're going to pay. So, like they mentioned, depending on what plan you're on, there's going to be a cost differential depending on which one you select. And these plans are offered by private insurance companies. So let's talk about plans, how they may help you with original Medicare when you're under option number 1. The reason why I bring up the Medicare supplement insurance company, because they're going to help you with the hospital co-insurances and deductibles that Medicare is going to expect you to pay. For example, let's say you're admitted into the hospital and you just have Medicare Part A and B only. Medicare is going to cover everything for that hospital stay except for a $1,500 deductible. And then all the physicians that read your test or visit with you, giving you a consultation are going to bill under Part B, and you're going to have a 20% co-insurance that's your obligation. So having a Medicare supplement plan is going to help you with those gaps. It's also going to help you cover 365 extra hospital days. It provides you benefits for hospice care, which is typically for, managing your pain and keeping you comfortable. Again, mentioning the deductibles under Part A and Part B will be covered by the supplement plan. You get some foreign travel emergency care up to a limit. I would advise you that if you're under original Medicare and you put a Medicare supplement plan in place and you travel outside of the United States, I would strongly tell you to consider putting a healthcare plan for the duration of the trip that you're away from the United States. because the benefit that you get under your supplement plan is very limited, and you could financially be exposed if you surpass that benefit. What the supplement does not help with, it doesn't help with prescription drug coverage, routine dental or vision, eyewear, custodial care, or long-term care. Some fast facts about the Medicare supplement insurance plan, or the Medigap policy. For this enrollment as well, you have to have Part A and Part B, and you have to live in the state in which the plan is offered. There is no medical underwriting if you put the Medicare supplement plan in place 6 months after enrolling in Part B at age 65 or older. You're in what's called your guaranteed issue period. It is nationwide coverage and no provider network. It's guaranteed renewable as long as you pay your premium. Plan premiums may vary for the same coverage. Plans with more coverage generally have higher premiums. And again, you must continue to pay your Part B premium to Medicare. So how much does it cost? So again, with Medicare, the Part A you have been paying to all of your working life. To enroll in Part B, there is a premium, and it is based on your gross adjusted income 24 months prior to coming to Part B. So again, I would highly recommend you go to medicare.gov and search for either Part B premium or the acronym IRMMA, which is IRMMA. There are deductibles that are, it's a set amount that you pay for covered services before your plan begins to pay. So like I mentioned, if you're admitted into the hospital and you have just Medicare Part A and Part B, you have a deductible of about $1,500 for that hospital admission. And then there are copays to the providers that render services to you while you're in the hospital of about 20%. Coinsurance is any amount you pay when the plan splits the cost for covered services with you by percentage. For example, under Part B, it's an 80-20. 80% is covered by Medicare and 20% is your obligation for Medicare covered benefits under the Part B category. Okay, let's look at Part C, which is the Advantage plan, Part D, which is prescription, and then the Medigap policies. So really, the way that you're going to make a determination may be driven by cost. Under the Medicare Advantage plan, there are some plans as low as 0 premium on a monthly basis. You will have some deductibles and co-insurances for services under A and B up to a limit. For the prescription, whether it's embedded in the Advantage plan or standalone, you may or may not have a monthly premium. There are deductibles, co-insurances, and co-pays, depending on what type of medications are being prescribed. For the Medicare supplement plan, there's an additional monthly premium that you will be obligated to pay. There are deductibles and co-insurances that will be your responsibility. So again, when we talk about an annual maximum out of pocket, that is only related to the Medicare Advantage plan. Medicare mandates that the private insurance company that offers the Medicare Advantage plan has to give you a limit on your exposure for services under A and B, whether it's in-network or in-network and out of network. So it's not like you're going to pay astronomical amounts because of the protection of the annual maximum out of pocket that's required. So how do I choose? Again, here's the same graph I've been referring to. It all depends on, the flexibility that you want to have with the plan that you're enrolled in. If you're the type of individual that would like to have no network, then being under original Medicare is the way to go, because as long as they're willing to file with Medicare, you can see any provider or go to any hospital that's Medicare approved and they file with Medicare. If that's where you want to be, then I would highly recommend you put a Medicare supplement plan in place, to cover the gaps that you have that Medicare would require you to pay under the A and B services. And then, of course, you would want to put a prescription drug plan in place. If, for example, you're willing to utilize a network that is offered by a private insurance company, and you are interested in having additional services like vision and dental and a fitness membership, or having the prescription embedded in the Advantage plan, then you would consider option number 2. It's more affordable than being under option number 1. But again, it's about how many dollars do you have to spend on healthcare. So again, when it comes to, the Medigap policy or the Medicare supplement plan versus the Advantage plan, again, we've touched on this a number of times. Under the Medigap policy, Medicare is going to pay first, and the Medigap policy is going to cover most of the costs that they did not pay. It doesn't cover drugs. You have a national network, and it does offer sometimes some additional value-added services. With the Medigap policy, you will have an additional monthly premium. You'll have a monthly premium for your standalone drug plan if you select that as an enrollment. And out-of-pocket cost depends on the plan that you choose. The convenience with the Medigap policy is that there are multiple plans from which you can consider a selection. And again, you would have to add the Part D. Under the Advantage plan, it's an all-in-one. It provides benefits of original Medicare and beyond. Many of the Advantage plans include prescription drug coverage, so you're not paying an additional premium. With the Advantage plans, you may have to use providers that are networked with the plan. The Advantage plans offer additional services like vision, dental, and hearing. Some plans may charge you a plan premium, especially if you're looking at like a PPO, a preferred provider plan. Typically, those have premiums. Often no additional premium for drug coverage. You will have co-pays and co-insurances for most services. And again, there's a limit to your financial exposure called an annual out-of-pocket maximum. And that's for the dollars that you put out of pocket for services under A, which is hospitalization, and B, which is doctor visit outpatient services. So when can I enroll? So if you're getting ready to turn 65, you can go to the socialsecurity.gov website and enroll 3 months prior to your 65th birthday for Medicare Part A and Part B. You can also do it on month 4, which would be the month of your 65th birthday, and then you have 3 more months after. So what I would recommend is that you are wise in timing the enrollment, because if you are, for example, retiring and leaving an employer plan and coming on to Medicare, you want to do it in such a way that your employer plan ends, let's say, at the end of the month, and Medicare starts the first of the following month, so that you don't have any gaps or have to pick up COBRA until Medicare's in place. A Medicare Advantage plan, you can enroll in that 3 months before, the month of, and 3 months after, just like you would for original Medicare. So enroll early to avoid gaps in coverage and late enrollment penalties, and may refuse or delay enrollment in Part B with credible employer coverage. So if you're currently working and have credible coverage through your employer, you will not have an enrollment penalty when you go to pick up Medicare A and B at a later time. There's some general enrollment periods. For example, let's say you missed the window for putting Medicare Part A and B in place. Let's say perhaps when you left an employer, you're past that window of enrolling, then you're going to have to wait for a request to enroll between January and March to pick up Medicare Part A and Part B, but it is not going to start till July 1st. Now you can pick up a Part C and D between April and June. So it's important to work with a professional that can give you guidance on when the enrollment needs to happen so that there are no gaps. For the Medicare supplement open enrollment period, or what's called guaranteed issue, again, the best time to pick up a Medicare supplement plan or a Medigap policy where you are not subjected to medical underwriting is during the first 6 months that you come on to Medicare with Part A and Part B. There is no medical underwriting, and they cannot issue you a decline for enrolling in a supplement plan. But if you wait past that 6 months, then you open yourself up to medical underwriting, and the private insurance company will access your health history, and this may cause you to have a higher premium on your supplement. There are some special enrollment situations. Let's say, for example, you work past age 65, then you have 8 months in which to enroll in Medicare Part A and Part B. That is what's called a special enrollment period. Now, the other criteria is that if you separate from your employer, you have 36 days in which to enroll in a standalone drug plan or a Medicare Advantage plan that provides prescription coverage. If you go past the 63 days and you do not enroll in a drug plan, then Medicare will assess you a late enrollment penalty. That's why timing is critical. All right, so here are some other areas in which you can have late enrollment penalties assessed by Medicare. Let's say you do not put your Part B in place, or you don't qualify because you didn't pay into it enough years that you were working, then there could be a premium assessed for Part A because it's not free to you. Or if you don't enroll in the timely fashion, there is a 10% penalty once you put Part A in place, and that is with you for the duration of the time that you have Part A. For Part B, none if you qualify for a special election period. Like I said, if you work past age 65 and sometime down the road, let's say when you're 67, you are going to retire and put Medicare in place, there will be no enrollment penalty at that time. But if you don't put it in, or you do not make the enrollment within the window that Medicare mandates that you do, there's a penalty of 10% of the monthly Part B premium amount for each full 12 months that you delayed the enrollment. There's also that 63-day window that once you lose credible coverage from your employer, Medicare wants you to have a prescription drug plan in place. If you don't do that, then you're going to have an additional 1% of the average Part D premium for each month that you delayed your enrollment. So when can I change my plan? So there is what's called a Medicare annual enrollment period. That is between October the 15th to December 7th. This is when you're allowed to join, switch, or drop a Medicare Advantage plan or a prescription drug plan. And that's when you see a lot of noise on television by the private insurance companies letting you know it's the annual enrollment period. You can also switch back to original Medicare, or leave an Advantage plan and go back to original Medicare, or vice versa. You can switch from one Medicare Advantage plan to another. And at the open enrollment, you can apply for the Medicare supplement plan that would go into effect for January the 1st. But again, if you're past the 6 months window of coming onto Medicare Part A and Part B, the Medicare supplement insurance company will do medical underwriting. The Medicare Advantage open enrollment period, which we're in right now, is only available for individuals that are on a Medicare Advantage plan. And this will allow them to either switch to a different Medicare Advantage plan or return back to original Medicare Part A and Part B. And during this time, you can also pick up a standalone drug plan if you return back to original Medicare, and you may want to consider picking up a supplement plan. And only one change is allowed during this time. Special enrollment periods. Depending on when you qualify for that special enrollment period, you have 2 full months after that qualifying event to either join, change, drop an Advantage plan, pick up a prescription drug plan, or enroll in an supplement plan. How can I save money? This is in particular with Medicare Advantage plans and standalone prescription drug plans. You know, even with original Medicare, they provide preventative services. Take advantage of those. Use plan providers networks. That's if you're on a drug plan or an Advantage plan. Ask about generics and low-tier prescription drugs when talking to your healthcare providers. Use plan preferred pharmacies or mail order pharmacies, and understand your status in the hospital. Let me touch on this. If you're admitted into the hospital, there may be 2 statuses that they will designate. You're either being observed or you're there as an inpatient. And this matters if you're on original Medicare. So understand the status that you have when you're in the hospital, because it could affect your ability, if you're on original Medicare, to go to a long-term care facility for rehabilitation and for Medicare to approve that. If you would like to learn more about financial assistance program, there are some programs out there for folks that have limited resources. It's called Extra Help, and that's for prescription. You may want to check with your state to see if you qualify for Medicaid. And then the Medicare Savings Program, it helps you pay the Part A and B cost. Those are private insurance companies that will deposit a certain amount of money when you're enrolled in an MSA that help you offset those costs. You can also call your SHIP office. That's a state program. They have professionals there that will speak to you about many of the things that I've talked about today. Where can I go for help? I would tell you, if you have not visited Medicare.gov, that you visit there. There's a lot of resources available for you. It explains the different parts of Medicare, the Part A, the Part B, the C, the D. Again, you want to search for Part B premium as it relates to IRMMA. You can call Medicare directly, or you can contact Social Security or the state Medicaid office. Now, when you go to enroll in Medicare, that is done through the Social Security .gov website. They're the ones that take the enrollment and will process it and communicate to Medicare that you're requesting to enroll in Medicare Part A and Part B. And you can do it online at ssa.gov. And just because you're enrolling in Medicare at the Social Security .gov website does not require you to apply for Social Security benefits. Those are 2 different enrollments. You can either do both at the same time or one or the other. But in order to enroll in Medicare, that is done through the Social Security.gov website, and it's pretty straightforward. I would tell you that if you're planning on coming onto Medicare when you turn 65, I would be making that request for enrollment at least 3 months prior to my 65th birthday, so that it gets through the system and you get all the approvals that you need, so that when you sit with a professional like myself, you have that red, white, and blue card so that we can complete the enrollment for when you want it. So I want to thank you for joining us for our virtual Zoom meeting on the concepts of Medicare. If you would like to schedule a one-on-one appointment, please give the office a call and they will reach out to me and we will schedule that appointment so that we can make sure that you are fully aware of what you need to do to be timely with your enrollment. Again, meeting with me comes to you at no additional cost. Again, I want to thank you for your time and I want to wish you all good health. Thank you.